Hello and welcome to our webinar here today. My name is Beth Peterson and I'm joined by my colleague Heather Cianci, and we're very excited to present on the topic Exercise versus Therapy for Parkinson's Disease. How do I decide? And before we get started with the presentation here, we do like to take a moment to acknowledge the funding support that we've had, which helps make LSVT Loud and LSVT Big possible and what they are today. We've had funding support from the National Institutes of Health, the Michael J. Fox Foundation, the Davis Phinney Foundation, the Parkinson Alliance, and the family of Lee Silverman, who the treatments are named after in the Lee Silverman voice treatment. So I just wanted to take a moment and let you know who's presenting to you today. As I said, my name is Beth Peterson. I'm a speech-language pathologist. I'm one of the LSVT Loud training and certification faculty members with LSVT Global. And I'm joined by Heather Cianci, who's a physical therapist, and she's one of the LSVT Big training and certification faculty members with LSVT Global. And the instructor biographies on this next slide have a little bit more information about us if you'd like to read more about our biographies so that you know who is speaking with you here today. And we do like to disclose that all of the LSVT Global faculty, so myself and Heather included, have financial and non-financial relationships with LSVT Global. The non-financial relationships include a preference for LSVT Loud and LSVT Big as treatment techniques. And I'm an employee of and I receive lecture honorarium and travel reimbursement from LSVT Global. Heather receives honorarium, consulting fees, and travel reimbursement from LSVT Global. And next I'd like to just give you a plan for the webinar so you know what to expect today. So first I'll start with some logistics. And right now everybody in the audience, your microphone is automatically muted. And that's just to make sure that we don't have background noise from the various environments where you may be. But you can still ask questions even if you're muted. So there's a few ways to ask questions, and we'll present those on the next slide as well. But just so that you know, you can either type in a question, and you can do that by clicking on the question box on your webinar control panel and then typing a question. And then I'll see the question and I'll read it out loud, and myself or Heather will answer it. Or you can raise your hand, and if you raise your hand, you'll just click on the hand icon on your webinar control panel. I'll see that you have a question, and then I'll unmute your microphone and call out your first and last name, and then you can ask your question out loud to the group, and then myself or Heather will answer live. And then you can also always email us. So if you think of a question after the webinar, and we'll put up that address at the end, but it's info as in information, so info@lsvtglobal.com. And I also wanted to point out that there are some handouts for this webinar. So again, if you look at your webinar control panel, you'll see a handouts tab. If you click the plus sign on that tab, you'll see a couple handouts. The first is the webinar schedule, and the second one is the handout for today's webinar, so that you'll have these notes for today and then also for future reference. So you can download that, the handout, and then you'll have that to take notes on, or again just to refer back to in the future, and that will be in PDF format so that you can print it out and have a hard copy as well. You'll also receive that handout in a follow-up email in case you have any trouble downloading it here today from the webinar. So I just wanted to cover the logistics, and then we'll present the webinar, which will take up most of the session. We have a lot of great information here for you today. So it will take up most of the hour, but we would like to have some time at the end to do some question and answers. So we'll leave a few minutes at the end for that. And then at the end of the webinar, when you X out of the webinar, there's going to be a survey that will pop up on your screen. So if you're able to take that, we really appreciate your feedback. It makes us know if we're doing a good job, if there's things we can improve on, and then also if we're covering the topics that you would like us to cover, or there are other topics that you'd like us to cover in the future. So if you have a few minutes to spare, if you can fill that out at the end, we really appreciate your time and your feedback. And this this slide just shows you, again, how to ask question live, either by typing in the question box, raising your hand, or emailing us. So you can refer back to that if you are having any trouble or would like to ask a question. And for today, the objectives of today's presentation are, we hope that at the end of the presentation, you're able to describe the differences between exercise and therapy, also able to discuss the research on exercise in Parkinson's disease, and describe the elements of LSVT Big and LSVT Loud protocols and how they align with principles of activity-dependent neuroplasticity. And on these next two slides, we just wanted to take a few moments to see who we have in the audience so that we can tailor the webinar as much as possible to everyone in the audience. So I'm going to pull up a poll that will display on your screen, and we just want to see who you are. So are you someone with Parkinson's? Are you a caregiver or a loved one of someone with Parkinson's? Are you a professional speech pathologist, physical or occupational therapist, or a graduate student in one of those professions, or other? And so I'm just going to pull up that poll here and launch it, and if you can just take a moment to let us know who you are, and then again we can best tailor the webinar to who we have in the audience here today. All right, great. So it looks like most people have put in their selection. Okay. All right, so thanks. We have a lot of individuals tonight or today I should say, depending where you are, that have Parkinson's, and then we also have some caregivers and loved ones, professionals and graduate students, and others. So we have a little bit of everybody. So I'm going to close this poll. And then we have one other one for the individuals who do have Parkinson's. Have you ever had LSVT Loud, LSVT Big, both or neither? So I'm going to pull up that poll. Oh, sorry, we went to the wrong page there. Okay, let's pull the slideshow back up here. All right, okay, so I'm going to launch that poll, and if you're a person with Parkinson's, if you can respond to that one, and then we'll know again what type of therapies that you've had in the past. All right, so I think most people have voted there. So we have about 20% who have had LSVT Loud, about 10% who have had LSVT Big, 20% who have had both, and about 50% who have had neither. So again, a nice mix of people here today. All right, so thanks for taking the time to put in that information. So I'm going to turn it over to Heather, who's going to get started with really the heart of our content of the webinar, and then we'll go back and forth throughout the presentation here today so you can hear a little bit from both of us.
Great, thank you so much, Beth. And we're just going to give Beth a moment to reload those slides back up there for us, and we'll get started talking about exercise versus therapy for Parkinson's and how do I decide. And like Beth said, we're going to split our time between talking about LSVT Big and LSVT Loud. So one of the things that's really important to know is that exercise is completely vital if you have Parkinson's disease. It's really not an option at this point not to be engaged in some form of physical activity if you have Parkinson's. The thing that we know, though, is that specific exercises and the way that we prescribe these exercises and do these exercises are really important. So they need to be intensive, they need to be specific to your needs, they need to be challenging, it needs to have consistency, so that means there's no taking off time from that. It's an ongoing disease process, so it's an ongoing exercise process, and it needs to be meaningful to you. So it means that it has to be important to you, and it's going to help you to take care of specific things that you want to enjoy in your life. Next slide. And exercise-based rehabilitation, when we're talking about speech-language pathology, physical therapy, and occupational therapy, really is becoming a part of the routine management for people with Parkinson's. It's no longer that we're only using medications. It's no longer that we're only hoping that those medications will last for a certain amount of time and then the person is left to just have surgical options. We have now the option of empowering people through using exercise-based rehab specifically for the needs of our people. Next slide. So I think there's a little confusion out there, and sometimes it can be with therapists, it can be with physicians, it can be with just people with Parkinson's. What are we talking about when we throw around terms like exercise and activity and therapy? Well, Beth and I are going to spend some time today and help you to kind of tease that out so you understand it a little bit better. So when we're talking about exercise, we're talking about an activity that requires physical effort, and it's carried out especially to sustain or improve health and fitness. So that definition comes from our regular dictionary. Now, when we compare exercise to what the World Health Organization terms as physical activity, it means any kind of bodily movement produced by your muscles that requires energy. So getting up from your chair and walking into the bathroom, that's physical activity because you have to use your muscles to do that. But what's important to know, and this is taken from a specialist in Parkinson's disease, Dr. Margaret Shankman, and she says that exercise helps correct specific underlying problems that interfere with daily function and lead to falls. Activity, on the other hand, keeps you going, and it's critical after supervised exercise. So that means what's really important is to be seen by a rehabilitation specialist first so that they can set you up on the perfect program for you, and then afterwards help you to continue to be physically active. Next slide. So let's break down further the difference between physical and occupational therapy. And these terms are coming from our national organizations, the American Physical Therapy and the American Occupational Therapy Association. So physical therapists, we are movement experts who treat people of all ages and abilities. And really the important thing is that we're here to help you improve and maintain not only your functional ability, but also your quality of life. We work to create individualized treatment plans, meaning that the treatment that I give Mr. Smith is not going to be the same treatment that I give Mr. Brown, because they are individuals and have different needs. So I'm going to match these to your goals, as well as helping you improve your fitness levels and your functionality. Now, physical therapist assistants are educated and licensed clinicians who work directly under the supervision of physical therapists. An occupational therapist and occupational therapy assistants really help people across the entire lifespan to participate in the things that they want and need to do through the therapeutic use of everyday activities. So a lot of people say, well, occupation, I'm retired, I don't need to have occupational therapy. It's really the occupation of life. And all of the therapies that we're talking about here adhere to what we call evidence-based treatment, meaning that we have research that supports what we do for individuals. Next slide. And then we're talking about speech-language pathologists. These are individuals who work to prevent, assess, diagnose, and treat not only speech, but also language, social communication, cognitive communication, and swallowing disorders across the entire lifespan. And speech-language pathologists really do work with a full range of human communication and swallowing disorders with individuals, like I said, of all ages. And this is the information that comes from their national organization, the American Speech-Language Hearing Association. Next slide. So when we're talking about physical, occupational, and speech-language pathology, we're talking about rules and regulations that we are guided by. And we're going to specifically talk about Medicare because most insurance companies do follow the guidelines set forth by Medicare. And Medicare states that the services that you receive from a therapist really need to be provided by a qualified professional. So that means that we are licensed and we are specialized. So it means that you need the expertise, knowledge, clinical judgment, decision-making skills, and the abilities of the therapist that really will help to improve the life of the person with Parkinson's, the care partners who are there, and everyone who's a part of that team. So it's not just a personal trainer, it's not just the yoga instructor, and it's not just someone who started an exercise program that they like. These are licensed professionals who are helping to make these decisions for you and with you. Next slide. And it means that we are not merely supervising you. It means that we're applying our skills by actively participating with you. So that means we are with you one-on-one, helping you through the treatment, and that's exactly what we do with both LSVT Loud and LSVT Big. The other thing is that we have to document. We need to talk about what's going on, and our descriptions of what we do need to describe why it is skilled. And we are also writing down information about how you did that day. Are you getting better? Are you having difficulty? Do we need to work on something a little bit more? And we're really showing that we're hoping to make judgments towards your ability to improve. And then we can make changes to modify the treatment and make things hopefully more challenging for the next time that we work with you. And these are taken specifically from the Medicare manual. Next slide. So what are we talking about specifically with individuals with Parkinson's? What are the barriers that individuals have to movement and communication that underlines what we do as therapists in LSVT Loud and LSVT Big? Two main important things here are bradykinesia, which is the slowness of movement, and hypokinesia, which is the smallness of movement. Those two things work against one another and with one another to really make movement and communication quite challenging for people with PD. The other difficulty is sensory calibration, the ability to feel what you're doing. So oftentimes people with Parkinson's don't perceive that their movements are too small, and they don't perceive that their voice is too soft. And when we're telling you to make normal movement sizes, or we're talking about talking at a normal level, you will sometimes say to us, well, that feels too big, that feels too loud, that doesn't feel right. And that's because that internal awareness is not calibrated to where it means. So people with PD aren't cueing themselves to make those bigger movements or to speak with those louder voices. And then also there is a degree of neuropsychological problems. So we know that difficulty with sustaining attention, doing two things at once, shifting your attention from one thing to another, and then some people also suffer from difficulties with anxiety, and for individuals with balance problems, that fear of falling. So all of those things together really can make a barrier to movement and communication. Next slide. The other thing when we're talking about that self-awareness or that self-ability, just wanted to touch on two studies here. A first study in 2012, when they were talking to people with Parkinson's disease, out of the 10 motor symptoms that people were reporting, and when they were tested, they said that most people with Parkinson's, out of those 10 symptoms, really were shown to have decreased speed and reduced amplitude. So they were moving smaller, talking lower, and they weren't taking as big of movements. Now, another study that was in 2016, it said that people with Parkinson's actually seem to have a better awareness of their externally observable symptoms, meaning things you can see, meaning that you know your walking is off and you can see your tremors, you're more aware of that, but that people are not internally aware of the problems with the slowness and the smallness of their movements that affect their function and their communication. Next slide. So we know that it takes intensive effort to overrate that bradykinesia and hypokinesia. It's like walking through thick cement. And this is how LSVT Big and LSVT Loud work to really go against that. And we'll talk more about that as we go forward. Next slide. So what does the research tell us about physical exercise in Parkinson's disease? Well, we could have an entire webinar about each of these treatments that are out there. There is a lot of really new information that's out there about all different forms of physical exercise, from treadmill training, dancing, specifically with tango, using boxing, cycling programs, progressive resistance exercises where you're strengthening yourself, Nordic walking where you're using the trekking poles, and research on Tai Chi. So there is no lack of research that's out there. But the challenge that comes about, and I'm going to read this to you here specifically, is that current studies are using inconsistent terminology. In terms with different meanings may be used synonymously, meaning, for example, using physical activity, exercise, and or physical fitness. And I even think sometimes using the term therapy interchangeably. So it's hard for people to understand that although there is good research out there on these, they may not be actual physical, occupational, or speech therapy that's being done. Next slide. So I'm going to break this down for you to give you a little idea of what's out there. This was a recent study in 2017, and it was about balance training. So they broke people into two groups using a physical therapist, or they did a home-based program on balance using a DVD, and they did this for 8 weeks. And what you see in the outcomes is that the therapist-supervised program was improving the subject's confidence, their speed of their gait, and their motivation. And this did not happen for those who just did the DVD. Another research study looked at when people do therapy, is it better for them to do it in a group? Is it better for people to do exercises alone, or is it better for people to have supervision with their programs? So these were all done, the group and the supervised exercise were done with physical therapy, and you can see they did a lot, 3 times a week for 4 weeks. And again, the individuals with the direct physical therapy did the best. And the last one here looks at a recent study where they're looking at a home program of strength training did making people stronger with Parkinson's actually help reduce their falls. And they actually found out that when they saw people at one time a week for 6 weeks, where they did strength training, mobility, strategy training, so new ways of moving, and falls education, there really was no difference in people who did this. They still were falling at the same frequency of people who didn't have that. So that one is talking a little bit more about the lack of frequency when people are seen only one time a week and they're not pushed to really high, hard, intensive levels. Next slide. And this is something that people will often say to me in my clinic, I'm not falling, I don't need therapy. And oftentimes we might have physicians who aren't referring their patients with Parkinson's for therapy because they haven't had falls yet. But we know that we need to get to people sooner rather than later. And some of the reasons why is if you look at people, how many steps people took, and this is people in the rather early to middle stages of Parkinson's, is that when they followed these people for 1 year, they had 11% reduction in the number of steps that they took and a 40% reduction in daily minutes of moderate intensity activity. So you can see that people are not walking as much and they're not exercising as rigorously. Now, when they also looked at the activity patterns for people in early to middle stages of Parkinson's for 1 week, take a look at how many minutes people spent in sedentary behaviors, how many minutes people were using low intensity activities compared to only 30 minutes of moderate intensity lifestyles. So even in the early stages of Parkinson's, people start to decrease their activity. And it's really important because we as therapists need to focus on treatments that deal with anticipated and or developing gait and balance problems so that we can delay disability and deteriorating quality of life. So this means we're not waiting for problems to start, we're trying to get to them before they actually begin. Next slide. I'm going to turn this portion over now to Beth, and she's going to talk to us more about voice.
All right, thank you, Heather. So yeah, I'm going to talk a little bit about the research that we found on vocal exercise in Parkinson's disease, and specifically a few areas that we get some questions on from clinicians and individuals with Parkinson's disease and their family members. So music and singing groups and that type of therapy, and how does that work? What about group voice therapy? And then what about at-home exercise? So I'll break each one of those down and show you a study or two on each of them so that we can see what that might look like. So what about music therapy? So this is a study we found that was done in 2012, and in this study they had 60-minute music intervention sessions, and it was with a small group setting and once a week for 20 consecutive weeks. And the results found that there were significant improvements in the singing quality and voice range at both the mid-mark, so at that 10-week mark, and then directly after treatment. This study didn't have any follow-up data, so we don't know if those gains carried out over time or what happened at the end of treatment, but there were some changes in singing quality and voice range right after treatment. It also found that there were no significant changes found for speaking quality. And so we'll talk about this more in the presentation later, but on one of the first slides, Heather was mentioning that exercise is vital in Parkinson's, but with Parkinson's, you want to make sure that you're exercising specifically to the deficits that you're experiencing. So as she was talking about, hypokinesia and bradykinesia, we believe are what are at the heart of what's causing the deficits. So in this study, we're seeing that they did get better in singing because they were singing, and we're not seeing those changes in speaking quality because they weren't focused on speaking. So it's just something to keep in mind when you're thinking about exercise programs. We want to change the deficits that we want to improve, or train those deficits to improve those. So again, just something to keep in mind when you're thinking about the music therapy. So it's something, it's not to say that this is bad, but it's more, if you're interested in singing, then this would be something that could improve potentially with your singing. Another study on music therapy, they had 12 90-minute weekly group singing intervention sessions, and at the end of that therapy, they didn't see any significant differences in vocal loudness, pitch range, or phonation. So their kind of overall take-home message was that group-based singing intervention hasn't been shown to result in significant improvement in measures of voice and speech impairment. So again, just singing is not going to transfer over to daily communication. And group therapy, again, another question that we get. So what about group therapy? Could I work in a group because I like the camaraderie, I like having other people to exercise with, it really pushes me. So we looked at a study with group therapy, and it was a group voice intervention working specifically on vocal loudness, and they had 90-minute weekly sessions for 8 weeks, and they did find that vocal loudness increased right after treatment, so after those 8 weeks. They didn't have follow-up data either, so we don't know what happened at the end of treatment, if those loudness changes maintained or not. And then also the vocal loudness increases were to a lesser degree than what we see in LSVT Loud individual treatment and the studies that have been conducted on that. And the article was really interesting. It talked about some of the limitations. So since it is a group setting, the participants may not be using the targeted effort and loudness. So they might not be pushed to those high effort levels that we know that individuals can get to, because it's hard to monitor everybody in a group if you're not individualized, working individually with those clients. And people didn't get as much motor practice because they had to take turns responding. And so we'll talk about with both LSVT Loud and LSVT Big how we really want that intensive motor practice to really drive home that muscle activation. And so if you're taking turns talking and responding, then you're not getting as much of that practice. And then it also couldn't be as personalized to the individual. So the article talks about, for example, how they weren't able to individually go over everyone's homework, so how they were practicing at home. And so it can't be as personal and tailored to you if they're working with other people at the same time. And we'll talk about how group sessions can certainly be helpful after you've received individualized treatment, and can definitely offer that support and keep you going and maintain any changes that you make. But we don't recommend group therapy for actually a therapy approach to improve your communication. Rather, this would be something to help maintain any gains that you make in treatment. And then what about practicing on my own? So we looked at a study. It had home-based deep breathing exercises. So there were 24 participants. They did 15 deep breathing exercises 3 times a day for 12 weeks. And the authors did find that there was improved pulmonary function and fatigue for those earlier to mid stages of Parkinson's disease. The study didn't have any measurements to assess voice or speech. So again, this is something they were training specifically deep breathing exercises, and did find improvements there after the end of the 12 weeks, but it's not something that transferred over to functional communication with voice or speech. And we weren't able to find any evidence to support completing direct voice or speech exercises on your own can lead to changes in functional communication. So practicing on your own is, again, not something, it's definitely something that is great to do, and we want you to continue practicing on your own, but we would recommend having therapy, individualized therapy first, and then continue to practice on your own to make those good changes in functional communication. All right, I'm going to turn it back over to Heather, and she's going to talk about activity-dependent neuroplasticity and describe what that is and what it entails.
Great, thank you, Beth. So I just love this little cartoon here. It says, what we do to our bodies outside promotes brain change on the inside. So I think a lot of people think of exercise as strengthening the heart and strengthening the lungs, but really the way that we do that is really going to help our brain to be happier, healthier, and to help individuals with Parkinson's have better quality of life. So let's look at the next slide, and we'll delve into that neuroplasticity. So when we're talking about neuroplasticity, we're specifically talking about something called activity-dependent neuroplasticity. And basically that means that our brain actually changes in response to the specific activities that we do, which actually are leading to improved function. So there are things to think about in how we actually exercise or how we use our bodies. So we know use it or lose it. People have heard that for a long time, and we just know in research that failure to drive specific brain functions really can lead to functional decline. I know anecdotally, just in my clinic, even without using research, that my patients who stay more physically active once they've completed their therapy and they really stick with it do much better than my people who have very low activity levels. And we're going to talk about the principles of neuroplasticity, meaning use it and improve it. So we're going to talk about specificity, intensity, complexity, salience, which means something that's very personally important to you, as well as timing. So let's take a look at those in the next slides. So specificity of training. That means if you are a sports player. You are a basketball player. You're probably going to practice basketball. If you're a hockey player, you're going to practice hockey. So that means you have to actually train for the sport that you're in. And in rehabilitation, it means we need to just train you to that specific functional skill. So if you want to be able to be heard speaking with your grandchildren on the telephone, we're going to practice that with you in LSVT Loud. If you want to learn how to play an instrument, then you have to practice that instrument. So the specificity of what we do and how we attack those underlying difficulties really is a key principle for driving that brain change. Next slide. And I love this one because oftentimes people will think, well, if I just do my leg kicks here and I can make my legs nice and strong, it's going to help me to be able to get up from the chair better. Well, that isn't necessarily the case. If we want to be able to get up from a chair in a safer, easier manner, then we actually, as therapists, need to be practicing with you how to get out of that chair. So again, that's a great example of how we need to be specific in training to what the deficits are. Next slide. And intensity. This is something that a lot of people struggle with, and I think that through both LSVT Loud and LSVT Big, we spend a great deal of time educating people on this. And it means that we're pushing people hard in many different ways, meaning we're pushing you to be louder, we're pushing you to be bigger. We're frequently working with you, so it's 4 times a week for 4 weeks. We're pushing how high of an effort level you're working at, the force at which you're resisting, that push against the resistance, and then we're helping you to get more accurate. So the intensity, the more accurate you are and the more correct you are with your movements and your speech, the better you're going to be. So we're pushing to a point of what we call healthy fatigue. And anyone who has taken on a new program knows that oftentimes you're going to feel tired after you work out. And if you don't, that probably means you're not pushing yourself hard enough. So, you know, there's good workout fatigue, and that's what we're aiming for. We want our patients to say, this is hard work. What a workout. You're relentless. And there's a difference between that workout feeling that individuals feel versus a strain or pain. We're not pushing people to injure themselves, but we're also encouraging you to really push yourself beyond your levels of what you perceive your capacity to be. Oftentimes people don't push themselves hard enough or have never had anyone give them the hope to empower themselves to actually work at those high levels of intensity. And again, that's going to drive the change in our brains. Next slide. When we're talking about complexity, that means that we need to make things harder. So we need to challenge you and make it more interesting. So we know that in research that when we're making challenging or complex movements and we work in an enriched environment, we see that there is greater change. So, and that is in animal models as well as human models. We can see this little example here of just some rats in a very boring enclosure in being tested in a certain activity versus rats who are really in a really enriched environment. So they're challenged, they have more things to do, there's more interaction going on. And we know that that really promotes the brain change. The other 2 things that are important is it has to be important to you. So that means it's salient. It means that if you want to be able to walk up and down the steps so that you don't have to use your first floor bathroom, then we're going to work on that with you. If you want to be able to return to your book club, then we're going to help you do that. So things that are, you know, promoting you to be successful. We want things that are rewarding to you and things that are emotionally important to you. And we know that actually dopamine plays a role in reward. So when we feel good about things and we get reward from that, our dopamine can change. The other thing is that our timing, and it's really important that you start your treatment as soon as possible in the course of your Parkinson's disease, but it really is never too late to start. And again, that's why I go back to people who are newly diagnosed and a lot of patients with young onset Parkinson's. We don't want to wait until someone starts having balance and falls problems. We want to start training them right away, and we don't want to wait until people are having difficulty with their speech and swallowing. We want to get to them right away. Next slide. So education is a large part of what we do. Both LSVT Big and LSVT Loud are going to help you, that person with Parkinson's, to recognize how your old movements are too small and then therefore too slow, and how your old voice is too soft. And that by using your new big movements and your new louder voice, this is really going to truly have a positive impact on your functional ability and your quality of life. We want to give you back the ability to do what you want to do. So we're going to talk about how we do this with both of these programs. Next slide. So it's a paradigm shift when we talk about LSVT Big and LSVT Loud. It's really a new way of seeing things. And there's three main ways that we have shifted this paradigm. And the one most important one, I think, is our target, and that's amplitude. So that is the bigness of your voice, the bigness of the steps that you take, the bigness of the reach. All of these things that we're doing that are too small and slow, we're now making bigger, louder, and faster. We talked before about the intensity and the high effort. That's part of our mode. How do we use this? How do we apply it? Well, we apply it in a very challenging way. And then that leads to what we call sensory calibration, meaning that if you start to walk faster and bigger, and it's taking you less time to be able to get to the bathroom, and you're getting there without having an accident, maybe you're going to feel more empowered to be able to go out to dinner again with your family, because maybe before you thought, well, if I have to go to the bathroom, I won't make it in time. So it starts to empower you. And same thing with speech. You know, maybe you're now being able to go out to a crowded restaurant and be able to keep up a communication and conversation with people around you, and they're hearing you. So it's you being able to figure out, hey, if I apply these things about being louder and about moving bigger, and I do what my therapist has taught me to do, I'm actually going to see a generalization in my movement and in my voice, and it's going to really empower me to feel better about how I can help myself. Next slide. So the work of the LSVT protocols really is based on over 25 years of NIH-funded research and clinical experience. So LSVT Loud is speech therapy, and that is delivered by LSVT Loud certified speech language pathologists, whereas LSVT Big is part of physical and occupational therapy, and that's delivered by LSVT Big certified physical or occupational therapists, physical therapist assistants, or certified occupational therapy assistants. Next slide. So our protocols for both are structured, they're based on evidence, and they are protocols that are developed specifically for the needs of people with Parkinson's. And I said this before, we adhere to those principles of activity-dependent neuroplasticity, as well as motor learning. So it's intensive, it's challenging, it's specific to your needs, and it's personalized. So we want to impact you on the levels that you need help with. Next slide. So LSVT Loud and LSVT Big are separate protocols, but each consists of treatments that are delivered on 4 consecutive days a week for 4 weeks. So that's going to give you 16 sessions. It's a 1-hour individual session. Not only are we working with you in the clinic, but we also provide you with daily homework and carryover assignments. And basically, we are helping to provide you with a learning ability to have a lifelong habit of continuously thinking big and thinking loud. Next slide. So our goals for people with Parkinson's in both of these is that you're going to use your louder voice and your bigger movements every day, and that your louder voice and your bigger movements will last over time, that you will start calibrating yourself and knowing what you need to do, and not just having the therapist be the one who's always helping you with that. Next slide. So let's take a brief snapshot at our LSVT Big treatment sessions. I know some of you have been through it, but for those of you who haven't, it consists of 7 maximal daily exercises, 5 functional component tasks, which we'll talk briefly about. And one of the functional component tasks is always going to be sit to stand, because we know everybody needs to work on that. The ability to walk big, and then what we call hierarchy exercises. And these are things that you've identified with your therapist that you want to be able to do better. So maybe it's getting out of bed, playing golf, whatever it is. We're going to work with you, start out on the simple end of the spectrum, and then increase that complexity across those 4 weeks of treatment until you're able to independently do what you need. I mentioned before that we give you homework, and then we also give you carryover exercises. So that's where we make you do things outside of the clinic where you're able to kind of show off your new voice and your new body movements. Next slide. I'm going to turn this back over now to Beth and let her talk a little bit about the LSVT Loud sessions.
All right, thanks, Heather. So yeah, this gives you a snapshot of what an LSVT Loud treatment session looks like. And so we start with 3 daily exercises The first are maximum duration ahs, so saying ah with a loud voice with healthy quality, and then a maximum fundamental frequency range, so going high and low on the ahs, so ah, that would be a high, and ah, that would be a low, so again working at that healthy vocal loudness. And then we have maximum functional speech loudness, or what we call functional phrases, which are 5 repetitions of 10 phrases that we get identified by the client that they say every single day, and we practice those in treatment and then also again for homework. We also have hierarchy exercises, and this ranges again in complexity starting with week 1 to week 4, where in week 1 we practice using a loud voice at the word and short phrase level, building up in complexity across the 4 weeks to have you using your loud voice more automatically in conversational speech. And so again, that progresses in complexity across the 4 weeks to get to that functional goal at the end. We also have homework all 30 days of the month, so not just the 16 days of treatment, but also the 3 days of the week you don't have treatment. So all 30 days of the month. And this also includes carryover exercises, which are opportunities to use your new loud voice in real life situations outside of the treatment room. And we'll go through on the next slides to really break down each of these different elements so that you know what the sessions look like. And so how do these daily exercises help you? So they're really helping you with function. So through the treatment programs, we're working for you to be able to completely start and stop, and this will help with preventing festination, retropulsion, and freezing of gait. So that would be with LSVT Big, working on those direction changes, so making turns, working on your aerobic endurance, and then also your vocal endurance with LSVT Loud, working on balance and strength, and then with LSVT Loud, also some swallowing. It's not direct swallow treatment. There is some preliminary data to show some improvements with swallowing. Also can help with intonation. And then we're really focused on functional ability. So what do you want to be able to do? And that's what these daily exercises are helping us target for you while you're in the treatment programs. So the daily exercises in the LSVT protocols, so for example, those long ahs or a rock and reach in the LSVT Big program, those aren't the end goal of therapy, but rather they're tools to help facilitate that improved loudness, that improved movement, because we have that improved function as the overall goal. And so those daily exercises we think or a way to think about this is a nice image that Heather found where they really link us into function. So we're practicing those daily exercises every single day for that month of treatment and for homework, and they're really linking us into that overall functional goal of improved movements and improved overall communication. And so this is an example from LSVT Big, where one of the treatment exercises that they do as part of the daily exercises is a rock and reach. And you can see here we have Jenny doing the rock and reach exercise, which you would do in the therapy program. But the treatment goal is to have better arm swing and stability when walking the dog. So that's how it translates from the practice in the treatment session to the overall functional goal outside of treatment to improve quality of life and daily living. And Heather, if you want to step in and talk a little bit more about some of these examples here.
Sure. So these are what we call our multidirectional repetitive movements, stepping forward, stepping to the side, and stepping back. And these exercises really are meant to help you improve in how you step in everyday life. So if you need to step back out of the way of someone, if you need to step back to open the oven, if you need to be able to step forward, if you have difficulty with freezing of gait. And you'll also notice how big she keeps her posture, and she's working on opening her arms and keeping them big. And that's also going to help with function as well, as being able to, in that first picture, take a look at maybe reaching your arm into a pocket, being able to reach forward into a closet. And then we know that people with Parkinson's have difficulty getting that full range of motion with the shoulders going backwards when we're walking. So that last exercise there with the arms behind the back can be really helpful for that. So we're looking at these as exercises, but again, they're just a stepping stone or a link to something functionally that you need to be able to do better.
All right, thanks, Heather. And then next we have a LSVT Loud example. So one of the treatment exercises is the long, loud ah that you do at the beginning of treatment. And the end goal of treatment is not to be able to have a long, loud ah, although you will have that, but the end goal is to have a louder voice in conversation. So maybe it is that you want to be able to talk to loved ones on the phone better, and so that long, loud ah is, again, the stepping stone into having that functional goal of a louder voice on the phone. And so what are the functional phrases and the functional component tasks? So that's the next component of the therapy programs. And so these are everyday phrases and tasks that are chosen by you, the client. So the purpose of these is to overlearn important, commonly used everyday movements and phrases. And so you're going to have hundreds of repetitions of each in the month of treatment that you have. And they're going to help you bring amplitude thinking into everyday life. So either bigger movements with LSVT Big or a louder voice with LSVT Loud. And they're supposed to remind you of your big movements and loud voice outside of therapy. Because these are things that you do, movements that you do every day, or phrases that you say every day, the idea is that when you're home doing these movements or speaking these phrases that we've now hooked into your daily living, and you're reminded, oh, I remember doing this big movement in therapy, I'm going to do it now here at home. Oh, I remember saying that phrase in my therapy program. When my wife walks in the door, I'm going to greet her with that loud voice because we practice this every day in therapy multiple times. So we're also encouraging the consistency of your home exercise program and carryover outside of therapy because, again, these are things you're saying and doing every day anyways, and now you're focused on thinking big and thinking loud when you do them. And we're helping you realize how amplitude, so bigness of movement, loudness of voice, can improve your overall function. And in terms of progressing in difficulty, these phrases and these movements are never going to change throughout the 4 weeks of treatment. But we can add cognitive or motor challenges. So for example, with conversation, you might be doing a math problem or lists in your head or recitation or distractors, or sometimes I'll have people count by threes in their head while they're doing these exercises, to add that cognitive challenge as the weeks of treatment progress, because you are going to do that type of dual tasking in everyday living. Or maybe there's some memory or balance challenges, speed challenges, or having a weight on your wrist or your legs while you're trying to do these other actions. So why do we do these? Again, because we live in a dual tasking world. We want you to be able to speak with your loud voice while you're also thinking about something else in your head. These have a real-world application and they drive that neuroplasticity. So if you go back to that slide that Heather was talking about where you saw the rats with that nice enriched environment, and we see that if we keep these challenges, keep that complexity up, we are driving that neuroplasticity, those changes in the brain. And because we actually do multiple things in real-world daily living, so we want to make sure we're also doing that in therapy so that it transfers over. So we really think of these functional phrases and movements as your mental sticky notes. So they help you think loud and think big, both within the treatment session, and then also they hook into your everyday living to remind you to think loud and big when you do those movements and phrases at home. And next we'll talk about the hierarchy exercises, and these are done in both LSVT Big and LSVT Loud. And these are identified through a discussion with the individual on their interests and hobbies. So they're made salient and meaningful to each individual person that goes through the treatment, so we can make sure that we're working on what you want to be working on. And they're tailored to match the severity of the speech or movement symptoms. We're working towards your long-term communication or movement goals. So even though we start more basic in week 1 of treatment, we're working to get to where you want to be functionally at the end of 4 weeks of treatment. And the primary focus of the second half of treatment are these hierarchy exercises. So in the hour-long session, these hierarchy exercises will take up most of that 30-minute portion at the second half. So the next slide has some real-world goals of these hierarchy tasks so that you have some examples. So it might be with LSVT Loud, you want to maintain your voice for teaching or lecturing or other job responsibilities that you have where you need to maintain that good quality loudness to be able to speak effectively. Or maybe socially you want to be better understood at church or at a restaurant, reading to your children or grandchildren before bed, being understood on the telephone. We get that a lot where an individual with Parkinson's will say, oh, I don't even answer the phone anymore, people can't understand me. We want to empower you and give you that back. So we'll work for those 4 weeks to make sure at the end of treatment that you're confidently able to answer the telephone and be understood by your loved ones. Making sure that you can effectively communicate your needs with care partners or caretakers, and so that would be for not only for function but also for safety, so making sure that you can safely communicate what you need. And then being able to converse with your spouse and family without having to repeat all the time. We hear from people all the time how frustrating it is to not be heard, and the third time they get asked to repeat, they just decide they don't want to talk anymore. And so that's what we're trying to eliminate and make sure that we're empowering people to have that confidence in their communication. With LSVT Big, some of the goals might be getting in and out of bed, or doing laundry, going out to church or a restaurant, playing with children or grandchildren, going shopping and being able to do that effectively. Transportation, so being able to get in and off the train or a bus or in and out of the car safely and effectively. Walking down to the mailbox to get the mail every day. Being able to clean the house more efficiently and effectively. So these are things throughout the 4 weeks of treatment that your therapist would work on to build, again, starting with that very basic stepping stone to build that complexity across the 4 weeks of treatment. So by the end of the 4 weeks, you're able to do these movements more efficiently in your functional daily living. And Heather, if you want to talk a bit about the walking, that's part of LSVT Big.
Absolutely. So this is part of every single session when you work with your therapist, and it's going to depend on what you're using. Some people might be using a cane or a rollator. Some people may be actually rolling themselves in a wheelchair or walking themselves in a wheelchair with their feet. And we focus on the amplitude. So that is the bigness and the size of your step. This is where the difficulty comes in with the shuffling, with the freezing of gait, where people tend to feel like their top of their body is moving and their feet aren't catching up. So over time, as you start to get better at being able to do that, we're going to add in more challenges. So we're going to change the environment, go inside, outside, carpeting. We're going to go up and down ramps. We're going to try to distract you when you're walking. We might make you walk longer than you thought you could. We might have you do dual tasks where you're carrying your book and your cup of coffee, or you're carrying a bag of groceries, or you're trying to use your phone, or we're having you answer questions, because walking and talking, oftentimes the two go together. So again, we make that part of every session to help you with that functional ability. The other thing about homework is really the most important thing is that by the end of your treatment, you're going to have a really well-established homework routine that you're going to want to continue to do on your own. It becomes an established part of your everyday life, just like you take your medication for your Parkinson's every day, or just like you brush your teeth every day. We want you to do your homework for the LSVT Big and LSVT Loud. And the homework during the treatments is, we're not asking for a huge time commitment for you. We're asking you for 10 minutes one time on your treatment days, so meaning that you're having therapy in the morning and then you're doing your homework in the afternoon, and then on your non-treatment days, so those other 3 days of the week, we're asking you for about 15 minutes twice a day on the non-treatment days. So again, not a huge time commitment to feel much better about what you're able to do. Next slide. So our components, at least for our LSVT Big here, are those 7 daily exercises. We have you do all of the 7, however we've trained you to do them in the clinic. We have you, of course, like I said, doing your big walking, and then also that carryover assignment. And the carryover assignment is something that we want you to do outside of the clinic, where someone is going to recognize, wow, you know what, you walked to answer the door much better today. Or you know what, you were able to get up out of the car much easier today. So we're looking for real world exposure. With our LSVT Loud, they're also doing their daily exercises of their long ahs, their high and low ahs, and then those functional phrases where they're repeating the things that they're saying over and over again, just like our functional component tasks that I mentioned before. And then also their speech hierarchy exercises, as well as those carryover assignments. And again, this is not an option. Homework is a key to your long-term success, and it's really going to allow you to feel better and to speak and move better. Next slide. So why do we need those carryover exercises? Why are we giving you so much? Well, again, there's that mismatch between your perception of how you're moving and how others are perceiving you. So I'm not too soft. She just can't hear me. She needs a hearing aid. Or people will say, well, I can't speak like this. I'm shouting. Other people will say things to us like, I had no idea how small my world had become. And I can't move like this. People will think I'm crazy. So when we're getting you to the normal size of movement and the normal volume of your speech, people often perceive that as being too loud and too big. And the carryover assignments allow you to be able to see that the more effort you put in, the more normalized your speech and movement will be, and you'll get great outcomes outside of the clinic. Next slide. So remember, these are daily assignments. We're going to make them much more challenging for you, and they're going to be specific to you, and we're going to make you accountable for doing them. So we want to hear about them each time that you come in to make sure that you're doing that. So there is a big part of responsibility on your part to take part in your own care. Next slide. So after treatment, when you are done, we want you to keep your daily dose of LSVT Loud and LSVT Big homework exercises. So really, the best combination is that you are optimally medicated, you are doing those LSVT Loud exercises, and you are doing your LSVT Big exercises. Because when you put those all together, that's when you're going to have the most success. Next slide. We also have something now with postgraduate groups where we're training therapists that you are able to continue with this. So one of the things that you are allowed is when you're done with your therapy, you can always come back for tune-ups where people are allowed to come back and have therapy again to make sure they're doing well. Before, we were knowing that people were doing lots of different things in different groups, and the formats weren't systematic and really wasn't available in all areas. But we know that the groups are important afterwards, but they don't replace the need for individual treatment, meaning that you need to see a physical, occupational, or speech-language therapist first, have them work with you, have them facilitate what's best to your needs, and then set you on a path for continued physical activity. So our goal is we really want to increase consistency and availability of these groups, and we're going to talk in the next couple slides about how we do that. So we have postgraduate programs called Loud for Life and Big for Life, and these are teaching the therapists to help you once you've graduated to have these systematic exercises and groups. And it's really nice because we are especially training clinicians to be group leaders. It's going to make it much easier for you to have more people to go to and talk to. But again, the groups are only for patients who have already completed an individual sessions of LSVT Loud and LSVT Big. So you must have completed your 16 sessions before you can take part in the postgraduate group. Next slide. So Beth, if you want to talk a little bit about the Loud for Life.
Yeah, thanks, Heather. And this would actually apply to both of them. We should have Big for Life on this as well. This just gives a timeline of how those groups were rolled out. So we did the pilot launch of the test group back in July of 2015 and began training clinicians in spring of 2016. So then we're now at a place where the treatment or the groups are available for clinicians to be trained in online. There's online programs for them. And soon we'll have a new website where you can actually, on the website, search for groups in your area. Right now, those groups are available in certain locations for people that have been trained. We just don't have it on the website, but if you did call the main office, they can give you information on those groups for both Loud for Life and Big for Life. If you've already completed treatment, that's certainly something that you could participate in. So the next slides kind of just wrap up what we've been talking about here today. And this one just is showing you, does it take effort to have those functional changes in communication and movement? And yes. Is it worth the effort? We also say yes. Will there be days when you don't succeed? Yes, there will be. But we say that do the best that you can and know that your LSVT clinician, either LSVT Loud or LSVT Big, is there to help you be as successful as possible. So as we've talked about here today, is any type of regular intensive exercise, voice or general or physical, adequate for people who have completed LSVT Loud and LSVT Big? So we say that regular intensive exercise and activity is very important, but it doesn't replace a daily dose of LSVT Loud and LSVT Big. So why is that? As we've seen here, not all exercises focus on amplitude, and the amplitude focused exercise is needed every day due to those deficits with hypokinesia and bradykinesia. So that smallness of movement, that slowness of movement. So not all exercise focuses on the sensory awareness challenges for people with Parkinson's that Heather was talking about earlier in the presentation. So recognizing that you need to feel louder and bigger than you think just to be within normal limits. So it's important to become comfortable with those new, bigger movements and louder voice so that you can and will use them in everyday living. And then also, not all exercises are salient or individualized. So those functional phrases, those functional movements, as a part of LSVT Big and LSVT Loud are important for that long-term carryover because it's salient to you, it's meaningful to you. Those are the goals that you want to achieve. So can exercise improve your function? And so yes, it can if it includes task specificity. So again, training for what you want to improve. If it incorporates your individual goals, it does require sufficient repetition and intensity, and it needs to address that sensory mismatch to increase the likelihood of carryover. So again, making you comfortable with these new movements and the new louder voice. And another key is that you must keep practicing. So at the end of treatment, you may get these fabulous results, but if you don't continue to practice, just as if you stopped going to the gym, you would lose those benefits that you made. So you need to make sure that you keep practicing for the rest of your life, every single day, your daily dose of loud and your daily dose of big. And so this kind of breaks down what we see for exercise. It's important for heart, lung, muscle, bone, and vocal health. Should be a part of your daily program. But just basic exercise is likely not addressing your Parkinson's specific and functional needs. So we recommend that you see a therapist first to help you get set up with a personalized program. And then you can, of course, always be exercising together as well. But it is important to have the therapy. So on the right side, you'll see under therapy, either LSVT Big or LSVT Loud. Those are also important for your heart, lung, muscle, and bone health, should be a part of your daily program. And they do address your PD-specific and functional needs. So those hypokinesia, bradykinesia, dual tasking, assistive devices, gait falls, freezing, and activities of daily living, and they will challenge you daily. So again, while exercise is vitally important, and we always encourage that, it's also very important to have that individualized therapy to make sure that you're getting your functional needs met and that you're achieving those goals. So we really encourage you to make the commitment. So each program, again, is 16 hours of treatment, and we break it down and see how much time is that really. So it's really less than one full day. And Parkinson's may last 10 to 20 years or more. So it could be 87,000 to 175,000 or more hours of living with Parkinson's disease. So we really see this as a very small investment for a huge potential return. And these are some quotes that we've had for graduates of LSVT Loud and LSVT Big. So my voice is alive again. Or public speaking was my life until the Parkinson's gremlin stole my voice. I fought back with an LSVT clinician, my own private Wizard of Oz. So that was a very clever client that we had. For LSVT Big, by the end of the 4 weeks of extensive training, I had packed my cane away in the closet and I started riding my bike in 6-inch heels. Now that's quite an improvement. I certainly attribute everything I've accomplished to LSVT Big. Or LSVT Big has changed my life. I can free walk, arise from an armless chair, in or out of a car in a flash. The impact on my life is beyond a miracle. So these are really the quotes that keep us going as clinicians when we see the impact that these treatments can have on a person's quality of life. So in summary, we say that exercise is vital in the management of Parkinson's disease, and that the skilled services of professional therapists, so physical, occupational, and speech-language therapists, should be utilized for treatment specifically focused on your individual needs for people with Parkinson's disease. And those can be accomplished through LSVT Big and LSVT Loud. And then also that daily exercise post-treatment is necessary to maintain those treatment goals of improved movement and improved communication. And if you're interested in getting started with LSVT Big or LSVT Loud, you can ask your doctor for a referral and a prescription for speech or physical and occupational therapy for both evaluation and treatment. And that can be a good way to get started. You can also look on our website at lsvtglobal.com, and you can search by your zip code or city and state to see if there's therapists in your area. And then you can also call our office, the numbers on the slide there, and our staff can help you locate a clinician. And if you are interested, if you've completed the protocol and are interested in doing one of those groups, Loud for Life or Big for Life, you can also call that number and they can help find clinicians in your area too that are leading those post-treatment exercise groups. And for further learning opportunities, so we have these webinars that we offer multiple times throughout the year, and they're free. So we encourage you to participate in as many of these as you can, invite others. So we have these on demand, so you can view any of the recorded webinars that we do, and we record all the webinars, and there's a link to that on our website. And then we also have these live versions that we offer. So this is one of the live versions here. If you have any questions on either of the treatment programs, we do have LSVT Loud and LSVT Big experts, so you're free to ask any of your questions to either of the experts at info@lsvtglobal.com to get any of those questions answered. And we provided that Loud for Life and Big for Life update. We have a program called the LSVT Companion Home Edition that's available that can help with either treatment sessions, homework, or follow-up, and so there's more information about that on the website. And we do also offer LSVT Loud and LSVT Big Homework Helper DVDs, and those are available on our website or on Amazon, and that can be a helpful practice tool for your homework practice. Those aren't something that replaces individualized treatment, but it can be a tool to help with homework. So if you have any questions, I know we're a few minutes over, so thank you for staying with us here. But feel free to ask your questions or email us if you're running out of time here today. But you can either, again, raise your hand or type your question in the webinar control panel, and we'll address some questions here at the end. And I saw one come in earlier, so I do want to address that one here. And this is a great question. So this is when Heather was speaking. It says, the speaker says that we want to train before you get the speech or swallow problems, but so many therapists say you don't have a problem and don't need any treatment. Please clarify. So that really is a great question. So early on in the disease, you may not have as many kind of overt symptoms of Parkinson's. So either in speaking, overall communication, or with or with body movement. But we are seeing that those problems are still occurring. So it might be that if you're with a therapist, you're in, a quiet office, you are easily understood there. But if the therapist would add in maybe a dual either cognitive or motor task, are you able to maintain that loudness? If you're in a noisier environment, are you able to maintain that loudness? So those are some things that we specifically train LSVT Loud clinicians at the training and certification workshops to look for anybody that's diagnosed with Parkinson's, no matter how early on in the disease process you are, because we're seeing, even though the symptoms may not be as bad early on, we want to help maintain as much function as you have already before you're seeing more of a decline. And you may already see some of those changes, but they're not as noticeable until you kind of tease them apart when you add in some other challenges. So again, those are things that we train with the therapists. So if you're interested in the treatment, you can specifically talk to your doctor about getting the treatment. It may be that you're seeing a speech therapist that isn't certified in LSVT Loud, so you could talk to your doctor about finding a therapist who is certified in LSVT Loud and get an evaluation from that therapist, and then they can get you started with the treatment to again maintain as much functional communication as you already have. We would love to do that. That's really our goal, is that we see everybody right upon diagnosis before we're seeing those larger deficits with movement or communication, so that you're able to maintain your level of functioning as much as possible and decline that and decline those decreases. Okay, so another question came in, and Heather, this one is on LSVT Big, so I'll pass it to you. Is it too late to begin LSVT Big training once symptoms, moderate rigidity, and mild tremors set in?
Absolutely not. There is never a time where we can't assess you and work with you. So please, I would definitely encourage you to find someone who is certified in LSVT Big. There's always a way that we can help you in some way.
All right, great. Thanks, Heather. And I see a hand raised. So Barbara Ford, I'm going to unmute your microphone here. Let me make sure. So it says it's unmuted, so if you want to ask your question. And this is Barbara Ford. If you had a question, you can go ahead and ask it now.
I was wondering if there's any motivational tapes or videos that people could watch as they're doing this besides the ones that are out there?
Okay, so that's a great question. So are there any motivational tapes besides the ones that are out there? So the only ones that we have created are the LSVT Loud homework helper and the LSVT Big homework helper. I know there's a second LSVT Big homework helper that recently came out, but that's what we have. And yeah, that's what we have available for purchase. We don't have anything separate, any other type of motivational videos besides that LSVT Loud and LSVT Big homework helper.
Thank you.
Yes. Okay, and I don't see any other questions that came through here, but we would love to hear from you if you have questions after the webinar here today. So again, feel free to email us, info@lsvtglobal.com, and go ahead and check out our website, see what else we have there. And also, we would love to have you again on a future webinar. So thanks for your attention today, and we hope again to see you soon. And thank you to Heather for helping present.